first knee surgery when I was 16. I tore my ACL playing field hockey in high school. And so, I had my reconstructive surgery, I did my physical therapy, and then I started having kind of a slow onset of knee pain that eventually started limiting my running and my physical activity. Over the course of even a year, I probably stopped running altogether. And, I told myself, I'm working, crazy hours, I'm in my training, I'm prioritizing my job. And then in the course of the next year, it started affecting my job more, my ability to kind of be on my feet for 8 or 12 hours at a time, going up and down the stairs. And so once I got to that point, then I decided that I probably needed to see someone and address it. Promise of resolution to my knee pain, but also I liked the idea of being part of something new and innovative in the medical fields that could potentially be helpful for so many more people over the next few years. I think that I felt like I could do more than I was actually being told I could do. I felt like I could walk around with my knee extender even the next day, obviously just hobbling around my apartment, but I felt really good. The pain that I had before, I don't have that anymore. I can go up and down the stairs at work and not have to think about the fact that I'm going up and down the stairs. And then in my free time, I still can run shorter distances more because that's what my preference is now. I can cycle, I can hike inclines without a problem. So I definitely do it again, and I would recommend it to others.
Indication: MACI, autologous cultured chondrocytes on porcine collagen membrane, is made up of your own autologous cells that are expanded and placed onto a film that is implanted into the area of the cartilage damage and absorbed back into your own tissue. MACI is used for the repair of symptomatic cartilage damage of the adult knee. The amount of MACI applied depends on the size of the cartilage damage. The MACI film is trimmed by your surgeon to match the size and shape of the damage to ensure the damaged area is completely covered. Limitations of use. It is not known whether MACI is effective in joints other than the knee. It is not known whether MACI is safe or effective in patients over the age of 55 years. Important safety information. MACI should not be used if you are allergic to antibiotics such as gentamicin or materials that come from cow, pig, or ox, have severe osteoarthritis of the knee, other severe inflammatory conditions, infections or inflammation in the bone joint and other surrounding tissue, or blood clotting conditions, have had knee surgery in the past 6 months, not including surgery for obtaining a cartilage biopsy or a surgical procedure to prepare your knee for a MACI implant, or cannot follow a doctor-prescribed rehabilitation program after your surgery. Consult your doctor if you have cancer in the area of the cartilage biopsy or implant, as the safety of MACI is not known in those cases. Conditions that existed before your surgery, including meniscus tears, joint or ligament instability, or alignment problems, should be evaluated and treated before or at the same time as the MACI implant. MACI is not recommended if you are pregnant. MACI has not been studied in patients younger than 18 or over 55 years of age. Common side effects include joint pain, tendinitis, back pain, joint swelling, and joint effusion. More serious side effects include joint pain, cartilage or meniscus injury, treatment failure, and osteoarthritis. For more information, please see full prescribing information at maci.com.